am thrilled to be here, just because what you all are doing in practice, focusing on details, is a spiritual truth of our country.
You know, we can be Democrats and Republicans, but most Americans are patriots.
For over a decade now, good ideas have emanated from the BPC.
Thank you for convening this very impressive group of thought leaders.
Your organization has brought together leaders from across our society to advocate for common sense solutions to our most challenging problems.
Because if it's bipartisan, it's much more likely to pass.
When you have people philosophically and ideologically in two different worlds, and they put them together on a committee, that committee usually is not very productive. Once we get staffs blending, and John and I, they know that the members are friends and we talk, things can happen.
Thank you, Anand, for that introduction, and to the BPC for its important efforts.
Thank the Bipartisan Policy Center. You guys are great.
We all have bipartisan responsibilities to this nation, to defend principles that have long made America the beacon of hope.
It's going to take all of us to try to turn down the temperature and really focus on what unites us.
All right. Well, I want to welcome everyone to this webinar this afternoon. We appreciate you joining us for what I think is a very important topic, the market rate survey and cost modeling analysis, and why we really need both of these things in our toolbox. For those of you who don't know me, my name is Linda Smith, and I'm Director of the Early Childhood Initiative here at the Bipartisan Policy Center. Today, we're going to be joined by two people from the BPC staff who are going to go through some slides with you about the cost modeling, what it really is and is not. And then we'll be joined finally by two people out in the states who have actually been using this and have a discussion about this. And I have to say that it couldn't be more timely because, as many of you know, the cost modeling was a requirement in the Build Back Better legislation last year. It has been introduced now in both the House and the Senate Republican side of the aisle as a tool that they want to see this field using. So by the time we finish this webinar, I think all of you should understand and know exactly what a cost modeling is and why we really need to take it seriously. So to get started, I'm going to introduce two of my colleagues here at the Bipartisan Policy Center, Samantha Onyé-Trewergy, who is a fellow here at BPC, and she'll tell you a little bit more about herself, and her colleague and mine, Caroline Osborne, who is a project assistant here with the Early Childhood Initiative. So I'm going to turn it over now to Sam, and she's going to walk you through what has been a very, very thoughtful approach to looking at cost modeling. So Sam, it's over to you.
Excellent. Thank you so much for being here today. As Linda said, I am a fellow here at the Bipartisan Policy Center. Prior to joining BPC, I worked as the Chief of Early Learning in Chicago, and most recently as the Commissioner for the Department of Early Education and Care in Massachusetts, where I was responsible for leading the state's early education system through the COVID-19 pandemic. In both of these roles, I grappled with the fragility of the childcare sector and the lack of infrastructure to support working parents and their children. Nothing highlighted this like the global health crisis, and childcare was considered an essential service that was needed to keep the economy running, but many programs across the country really struggled just to keep their doors open. State leaders like myself scrambled to find new tools to basically just save the sector from collapse. And as a fellow at BPC, I spent the last few months talking with childcare leaders from across the country about their experiences during COVID and what they see as the needs for this sector as we move forward. What has become abundantly clear is the dire need for better tools to inform public investments in the country's childcare infrastructure. Can we pull up the slides? Cost modeling tools can help us be creative about addressing the persistent challenges in this sector, high costs for families and low wages for the workforce. Today's presentation will focus on the childcare business model and the challenges that face the childcare market. We'll also give an overview of cost modeling and review some preliminary findings from our state analyses. Then, as Linda said, we'll have a chance to talk with two leaders who are putting cost modeling into action, and you'll have a chance, of course, to ask your own questions. I'd like to start today by ensuring we're all using a common definition for childcare. In our paper and throughout this presentation, we'll use the term childcare to describe licensed and regulated non-parental care that's defined by each state. This includes center-based childcare, family childcare homes, as well as in-home childcare providers who offer services for compensation. These are the providers responsible for delivering the majority of our early education and care for children in this country. Over half of children in the United States are in some sort of childcare arrangement during their first 5 years of life. And since public education systems aren't generally available for children until they turn age 5, most families turn to private providers to purchase their care. 62% of families that use care are using center-based childcare, and another 18% are using family childcare homes. So who makes up these providers? While each state sets their own health and safety standards for getting a childcare license, in general, childcare is a mixed delivery system. And this means that parents have a choice of many types of providers to purchase their services from. This includes small storefront childcare providers, family childcare that's offered in maybe a provider's residence, or large multi-service nonprofits, faith-based preschools, and as well as multi-state franchises. Families may use one or many of these provider types in order to help meet the needs of their children and their specific work schedule. Yet, whether the provider is for-profit or nonprofit, a single site, or operating across the country, they are using generally a consistent business model to support their programming. Oops. Childcare providers generally rely on per-child tuition and fees model to provide the revenue that's necessary for them to operate. This means that these providers rely on actually enrolling children and getting the money after a child is enrolled and ready to be served in order to afford to buy the things needed to provide the care for their children. This means that they must have children getting services in order to pay for things they need to provide those services. Things like teachers, materials like books and blocks, supplies for cleaning, food for snacks and meals, all the things that go into a high quality program. The problem is that this model of operating relies on serving more families or charging current families more in order to actually get the investment you need to make and expand your business. This leads to a catch-22. Providers can't invest more in services without increasing their revenue, but you can't increase your revenue without investing more in the business. This business model leads providers to maximize revenue from families while limiting their expenses and things like wages and compensation in order to be sustainable. Ultimately, this model leads to high tuition for parents and low compensation for the workforce. However, despite attempts to limit expenses, childcare is still generally unaffordable for parents. In some states, tuition for a high-quality childcare program can rival the cost of a year of community college. Families that live below the poverty line would need to spend an average of 26% of their income to afford childcare. And the majority of families don't qualify for federal tuition assistance, so it's their responsibility to pay for this care out of their income. For providers, however, over 70% of their expenses are generally in labor and staffing, paying the caregivers who actually do the caring for the children. The only way for providers to make ends meet is generally to keep wages low. And in most states, that means the childcare workforce makes just close to minimum wage, with a national average of just $13.23 an hour for the childcare workforce. This makes it difficult to recruit enough staff to just stay open, and certainly to stay competitive with other employers who may also be recruiting this staff. The result? 4 in 5 childcare providers are short-staffed, and 30% of young children with working parents don't have any access to formal childcare. And before we move on, I also want to highlight the implications of this workforce shortage on quality. We know that high quality care is vital for children to be prepared for the future. Quality generally relies on trained caregivers who are supported with the tools and resources they need to provide the kind of engaging interactions that we want for our children. This requires caregivers who are willing to stay in the field long-term, hone their skills, and have the type of student-to-teacher ratios that allow the time to actually teach children. All of this becomes almost impossible without a sustainable revenue source and competitive wages. And competitive wages so that the children can get as much benefit from these services as their working parents. Like all markets, when we aggregate up these individual providers, childcare functions with a supply side and a demand side. All of the families seeking to purchase care make up that demand side, and the providers who offer care for families to enroll in make up the supply side. In a functioning market, demand and supply balance each other out, and families who are seeking to purchase care are able to find providers who are willing to sell care at an agreeable price. If this market were functioning well, that business model we just saw would be working. The price that families were willing to pay would cover the cost of care they wanted or needed. However, to better understand why this isn't working, we have to understand two specific dynamics of this market. First, the issue is that there are some fundamental challenges in the childcare market that make it very hard to operate this business model. First, while childcare is a necessity for most parents, there are limits to the tuition they can actually afford. In a functioning market, consumers or parents are able to pay for the services they want. However, that's not always true for parents. Like housing or transportation, childcare is a critical necessity to go to work and care for your children, but parents are constrained by what they are able to afford to buy. For example, it often doesn't make sense for a parent to regularly pay more for childcare than they earn, because that would jeopardize their ability to pay for other essential expenses like food and shelter. Thus, there's an artificial cap on what parents are actually able to pay for as tuition, and it's less than what it costs to provide quality care. At some point, if providers increase tuition high enough, many parents would be forced to just stop using care altogether or turn to other resources or even just leave work. This cap on what parents can pay distorts the market and makes this business model insufficient to sustain the revenue to support critical childcare services. The second dynamic is that the demand from parents is very unstable. Parents' childcare needs vary dramatically month to month, year to year. Things like having another baby, moving closer to a relative, changing a job that lets you work from home. All these factors could prompt a parent to change their childcare arrangements. But in order to invest in long-term costs like facilities expansion, salary increases, hiring additional staff, and guaranteeing them a job, childcare businesses require some sort of assurance of a consistent revenue source. This business model that we saw that relies on childcare enrollment does not offer the stability for an individual childcare provider to make these types of investments. Individual providers may keep wait lists to help mitigate this issue, and when a child unenrolls, they can immediately fill that slot. However, this means that the family on the wait list must wait indefinitely until another child leaves the program. Oops. Given these factors, this business model is simply insufficient to sustain critical childcare infrastructure that can serve our economy. And without a sustainable business model, the market is failing. Traditional interventions have focused on the parent side of the market, but they've really been unable to address these very fundamental issues with the market overall. The largest federal funding stream supporting childcare is the Federal Child Care Development Block Grant. Traditionally, this funding stream has targeted subsidies to low-income working families. However, The reach of this funding is limited, and it accounts for less than 10% of the families who are paying for childcare overall. These interventions have not only been critical to help low-wage workers to be able to enter the job market because they defray the cost of childcare for their children while they work. However, as I discussed, unfortunately, this type of intervention does not help address the structural issues in the business model itself. Most families can't access federal subsidies, so they still have limits on what they can afford based on their income. And the unpredictable fluctuations in child enrollment still prevent investments in wages. Despite being targeted and well-intentioned, family subsidies alone aren't really sufficient to shift this business model and really sustain the childcare infrastructure. On the other hand, there are examples of supply-side interventions that can help intervene with the childcare business model itself. Rather than targeted to the parents who qualify for subsidies, these types of interventions target the provider, either by providing funding directly to support operations or by defraying the cost of operating the business. So we'll look at some more specific examples later on, but these types of interventions really can range from things like operational grants or contracts to support providers' costs of operating, some stipends or wage enhancements that target teachers or other staff, or maybe providing stipends to cover expenses like food or supplies or other strategies that target the business itself. In essence, these are interventions directly to the provider, allowing them to provide quality care for families at a reasonable cost. These type of interventions ensure that the entire cost of the quality of care is not the burden of families alone. And when we can actually target interventions on both sides of this scale, we can get to the core market failures by changing the business model and making it sustainable. Because of plummeting demand during COVID-19, states were forced to pilot many supply-side interventions very quickly. But before we discuss the opportunity that this presents, let's look quickly at the tool that helps us understand both of these critical sides. To start with, let's look at one of the most commonly used tools used by states, the market rate survey. I know many of you are probably familiar with this tool, but for those of you that aren't, this is an analysis that is required by states of the federal government, and it is used to essentially to find out about private tuitions charged to parents across each state. It may look at the average tuition by provider type or across geographies. The market rate survey really is this vital tool to understand what parent tuition rates are and sort of codify the revenue that's used to support most childcare providers. But as we've discussed, it often doesn't account for some of the constraints that are specific to this childcare market. The market rate survey captures what parents in a region can afford to pay, but it doesn't necessarily help understand the challenges of operating a childcare business, and it doesn't help capture the true cost of care or the cost of increasing wages, for example. This is where a cost model comes in. So what is a cost model, and why is it different from the market rate survey? While there are many different types of cost models, in general, they estimate the average expenses needed to operate a business and produce a service. This can also be used to show what the cost will be to make improvements or invest in different components of the business, for example. While the image in front of you does not represent any real program, the illustrations are examples of things that might be included in a cost model. Facilities costs like rent, a lease, a mortgage, but that also might include costs to maintain a facility or upkeep it, depending on what the business arrangement is between the provider and the facility owner. Items purchased regularly to operate that business, the supplies may include programming supplies or classroom, books, food, but also cleaning supplies and diapers, all the items that are needed to just keep up with the kids on a daily basis. Finally, and this represents about 70 to 80% of programs' budget, is the labor and staffing. This really depends on the staffing model. You need to understand whether childcare in a state uses hourly or salaried employees, how long do their employees work, and how many teachers do they have in each classroom. If you're serving infants or toddlers as a childcare provider, for example, you may have more adults serving the same number of children than you do for a preschool or a school-age classroom, where the children don't require as much one-to-one care, like diaper changes. All these factors are calculated into expenses, and a cost model will help you calculate what it actually costs to deliver that service. This allows stakeholders to have a far better understanding of what goes into actually providing childcare. And then you can analyze the impact of various changes in things like regulations or wage or compensation standards or other kinds of investments that really drive quality improvement and sustainability. A good cost model captures all of the operating costs of the business, and it really allows stakeholders to look at the impact of changing any of these factors on the ability of a business to break even or even remain financially viable at all. As you choose what to put into a cost model, assumptions drive the output. For example, in this image, if we assume the wages are higher and there's an investment in training by the provider, the total cost of care increases. In childcare, one of the most pressing issues is this workforce compensation. Cost modeling can help measure the impact of incremental changes on a program budget. What would it look like to target a livable wage, for example? What kind of business supports would be needed if you were going to make 10 or 20% increases in wages? A cost model can help you look at the impact of that on an individual program. And by knowing the impact for an average program, stakeholders can start to look at what that would mean at a community, a county-wide, or statewide level as well. Cost models can also help provide a cost for each child who might enroll in that program, what we call a cost per child. For states that have used cost modeling to help evaluate their subsidy rates for families, according to the federal requirements, they've actually translated the results of their cost model to a cost per child by making some baseline assumptions on how many children might enroll in each provider, and then dividing the cost of operating by the assumed number of enrollment. This slide illustrates what we do when we estimate this cost per child. As you can see, the result of the cost calculated by the cost model are then divided by the number of children that are assumed to be enrolled. Because the number of children served by a program serving, again, infants, for example, may be far less than the number of children served by a preschool program, there may be some assumptions built into this type of calculation, and you have to decide how many children to account for based on the program model. There are other ways to use the cost model too, however, beyond just comparing a cost per child to a market rate. Cost models can also show how categories of costs contribute to operational expenses. This can be used, for example, to help identify an actual real way to reduce costs for a childcare operator and loosen up funds for other things. The Child and Adult Care Food Program is an example of a federal program that funds the cost of snacks and meals for some childcare providers. You can see in this graphic that by covering a monthly expense that would have otherwise been part of a program's operating budget, the cost of operating the business actually goes down. This means that the revenue that may now be captured could be used to invest in other things like wages and salaries. Looking at cost modeling tools can help identify ways to reduce costs for operating a childcare program without impacting the quality or needing to increase parent tuition. So, as I have referenced, states have been piloting incredibly innovative supply-side interventions over the last few years. During COVID, demand plummeted and parents lost jobs, worked from home, and grappled with remote learning in schools. The already fragile childcare market spiraled with this dramatic shift in demand, and programs across the country just began to close. Congress appropriated an unprecedented $52 billion dedicated to stabilizing the childcare industry nationally. And states look to use that funding on innovative supply-side strategies to save the critical childcare infrastructure. The federal childcare stabilization grants also recognize that traditional demand-side interventions just wouldn't be enough at this time. In Massachusetts, for example, we use that funding plus other COVID funding to create a monthly operational grant that helped providers continue to pay for facilities, supplies, and staff, despite changes in enrollment that continue to occur. States used a variety of innovative supply-side strategies, mostly trying to target staff compensation. Most states created wage supplements directly to teachers. Others incentivized employers to increase wages through contracts. Some states created bonus payments for increased wages by employers. And the supply side interventions seem to be working. A BPC survey recently found that childcare centers and family childcare homes of all sizes said government funds were extremely helpful for bringing stability into their programs through the crisis. At core, each of these kinds of investments is supporting the childcare business directly. Through conversations with state leaders over the last few months, we heard the issues that they've been trying to inform, design, and distribute new funding streams. The one primary one we heard were the limited tools that they had at their disposal to actually inform these really vital decisions. So before we get into our analysis, I think it's helpful to understand, for those of you who may not be familiar with what the federal government actually requires for states. The federal government sets the minimum standard of what data states must collect. And because the Child Care Development Block Grant has traditionally focused on subsidies to low-income families, states have been asked to use a market rate survey, as we discussed earlier. However, recently the federal government included a narrow cost analysis as well, a limited type of cost model that is used to compare the state set subsidy rates to the cost of providing childcare that meets those state standards. While the federal government does allow for states to use an alternative methodology for setting subsidy rates, most states have really just begun to explore innovation in this area. BPC used this narrow cost analysis, however, to better understand the ways that states have begun thinking about integrating cost modeling tools into their strategic planning. Caroline Osborne, a project assistant at the Early Childhood Initiative here at BPC, is going to help walk us through the analysis of what is included in the narrow cost analyses across the country and how states have begun to adopt this tool into their own context. Caroline?
Hello, everyone. My name is Caroline Osborne, and like Sam said, I'm a project assistant here at the Bipartisan Policy Center, and I will be discussing the current use of cost modeling across states. Can we pull up the slides? Okay. So BPC analyzed a total of 35 publicly available cost models in our report. And this map here shows the states that we identified as having a cost model. Those states colored in blue were identified as having a narrow cost analysis according to their CCDF 2022 to 2024 state plans. As you can see by this visual, most states that have a cost model have one for the purpose of fulfilling that narrow cost analysis requirement. There are 5 states who indicated they have a narrow cost analysis in their state plan, but we could not access the full report for our analysis. Those states are Florida, Louisiana, Maryland, Montana, and South Carolina, which are marked with an asterisk here on this map. So in total, we reviewed 21 cost analyses developed for those CCDF state plans. And then the remaining 14 reports that we looked at were cost models that were not included in the state plans. These cost models were commonly conducted with the Preschool Development Block Grant or non-government affiliated nonprofits. And those states with those cost models are marked in yellow. States that are striped yellow and blue, we found 2 cost models, one for their CCDF state plan and a separate one. And then DC and New Mexico, which are marked in pink here, received a waiver to conduct an alternative methodology, in this case, a cost model, to fulfill their CCDBG requirements. Each of these cost models and narrow cost analyses use different methodologies, and I'm going to explore 2 key components of those in the next slides. A key part of a cost model methodology is the cost lever. A cost lever is the variable that is changed in a cost model. So like in the example that Sam just gave, in that example, the workforce compensation was the cost lever. She showed how an increase in compensation impacted the cost of care. And the cost models that we looked at used a variety of different cost levers to see how it affected the cost of care. On the left side of this chart is the list of the most common cost levers that we identified, and on the right is the number of states that have cost estimates for those levers. The most common lever was provider type. This means how costs change depending on the provider's business model, which typically involved showing separate cost estimates for childcare centers and family childcare homes. Even if 2 cost models look at the same cost lever, it might be incorporated in a different way. For example, compensation is one of the most pressing issues in childcare and was frequently the focus of cost models. But there was a lot of variation in how it was integrated depending on the dynamics within the state and the goals of how the data in the cost model would be used. So sometimes states looked at how costs changed as provider compensation increased to the point of parity with K-3 teachers, while others looked at how state mandated increases in minimum wage would affect compensation and costs. Deciding which cost lever to focus on and how they are integrated are key decisions when developing the methodology and should be selected thoughtfully based on what decisions data from the cost model will be used to inform. And then those cost estimates can be made at different units of analysis. The unit of analysis is just the way the report analyzes and presents their cost data. On the left is the most common units of analysis that we found in the cost models that we looked at, and on the right is the number of states with cost estimates given in those units. The most common unit of analysis was cost per child. Like Sam said earlier, that's when cost data is broken down to show how much it costs to provide childcare to a single child. Sometimes this estimate might be broken down by age. So some reports looked at how there was a higher cost of care per infant when compared to preschool age children. The least common was financial sustainability, which meant that a cost model analyzed how changes in overall revenue streams impacted the long-term viability of a childcare provider or the entire sector. The data collection and cost levers determine which units of analysis are possible given the information that you're working with. So for example, let's say a cost modeler collects data on the average cost of running a childcare center and then looks at how increases in compensation impacts the cost of care for that average childcare center. This data and cost lever may allow you to estimate provider cost for the center, but it's less helpful if you want to estimate the cost of an entire childcare system across a state. This is because the different costs across geography for different provider types and other factors would also impact the overall cost for a system in a state. With just cost estimated for childcare centers, this cost model would not have the appropriate data and cost levers to make a system level cost estimate. So when designing methodology, it's important to think about the intended unit of analysis when you're selecting the data you're collecting and the cost levers. And then the unit of analysis should also be selected based on how you intend to use the cost model. So if a state wants to use a cost model to inform their per child subsidy rates, cost per child and cost versus subsidy rate might be the most helpful units of analysis. However, let's say a state wants to explore some supply side interventions like a child care desert grant. A child care desert grant is a supply side grant that would help a provider open or maintain operations in an underserved region. Data on provider cost versus revenue, and financial sustainability might be most helpful in determining the desert grant amounts that would allow providers to operate in that region. Cost models must be intentionally designed with a state's long-term goals in mind to be the most effective and useful. And so now that I've discussed the current use of cost modeling across states, I'm going to turn it back to Sam to discuss how cost models and the market rate survey can work together to inform childcare.
Excellent. Thank you, Caroline. So we hope that this helps show that states are really trying to design cost modeling tools to meet their needs, and really as well integrate the learning into the new ways of thinking about solutions for this sector. If we can bring the slides back up. Cost modeling is a very important part of that thinking, but it doesn't replace the market rate survey. In order to really truly transform this market, we need tools to look at both sides of the scale. We won't be able to address these challenges in the business model if we only understand demand and the price that parents are paying. If we truly want to make a sustainable business model for childcare, we must also have tools that help us understand it. And cost modeling can really help do just that. So it helps measure those wages and the fixed costs and the costs of operating under the business model that can help prompt more creative solutions. If we design better tools, then we will have better data to make data-driven decisions about the childcare solutions we're pursuing. Incorporating cost modeling tools can really help stakeholders design innovations around tuition-based business models and really ensure that families have access to the services they need. As the paper and this presentation will continue to state, we need interventions on both sides of the market if we're really going to truly support childcare infrastructure that we need for the future. Finally, I do hope that you will read the paper if you haven't already, given this comprehensive overview. And you'll see in there that we've offered 3 recommendations. The first is focused on the opportunity to at the federal level. By setting a more comprehensive framework, the Child Care and Development Block Grant could really encourage states to move beyond the traditional approaches of demand-side interventions and really foster a broader use of cost modeling. If the federal government could help support innovation and integrate that cost modeling across states. Second, given the work happening across all of the supply side interventions at the state level, state leaders could use support in identifying a few key questions collectively that can really help them accelerate the learning across the country. Finally, there's an emerging group of cost modelers working in childcare. And given that this really can't be a one-size-fits-all approach, aligning some common principles for the childcare field when using cost modeling would be an asset to help make sure that we are effectively capturing the potential of these tools. So as I wrap up, I'll leave you with this. Like anything in this field, we need an integrated approach. Cost modeling isn't a silver bullet, but it can help ensure that we are designing effective and efficient solutions for a fragile childcare market. But we need to work now and not lose momentum in solving these long-standing problems in the sector. We have a unique opportunity to think differently, use these tools, and build the childcare system that our children and our country deserve. I'll give it back to Linda to launch our discussion.
Okay, well, thank you, Sam, and thank you, Caroline, for that. It's a very complicated subject. You boiled down into something truly understandable. So thank you very much for that. Now we're going to turn to our 2 discussants that we've invited to join us. First, Teresa Hawley. Teresa is the Executive Director of the Center for Learning Funding Equity in Chicago, Illinois, and a former staff person with the governor there and has done the cost modeling herself, and we're anxious to hear from her. And joining her is Sarah Mead, who is the Deputy Superintendent of Early Learning at the DC Office of the Superintendent of Education. And DC is one of the entities that did have an official waiver, or I don't even know what you called it actually, to use a cost model in their work for the District of Columbia. So what we're going to do now is ask each of you to start by describing sort of how you use, what did you do? How did you use it in your particular case? And let's start with you, Teresa.
So Illinois got started with cost modeling a long time ago, almost 10 years ago, when we're really trying to answer this question of just how dramatically underfunded is our system. We wanted to understand, given all the investments that have been made, why weren't we seeing the changes we wanted to see in terms of kids' school readiness? And our easy answer to that is, oh, well, we're investing about a fifth of what we need to provide kids and families what we've been saying that they need. So that was our first foray into it. More recently, we have been using cost modeling to help answer a plethora of different questions. Once you have that engine built, you can use it in a whole bunch of different ways. So one really good example of this is when Governor Pritzker began his first term, he rapidly passed the rising minimum wage law. So we were on a path to $15 an hour minimum wage in our state. One of the things that we did because of that was then build a cost model to say, what's it going to take for people to be able to even legally operate a child care program in our state if we raise the wages like that, knowing that our wages for staff in many parts of our state were down at the $8, $9 an hour level. So we use cost modeling to help us really understand what was happening in our system and to project out what was going to happen in our system if we didn't take certain policy actions.
Okay, Sarah, how about you?
Sure. And you couldn't see me, but I was nodding along with a lot of the things Teresa said, because there are some similarities and also some differences in our experience. So the district, as Linda mentioned, has used cost modeling as an approved alternative methodology for subsidy rate setting as part of our Child Care and Development Fund state plan since 2015. So we were the first state in the country to be approved to use an approved alternative methodology. New Mexico, where my predecessor went to after DC, is the other state that has done this. So because it's our approved alternative methodology, we do use cost modeling for subsidy rate setting. And there are a number of ways that it has been particularly helpful in subsidy rate setting as the district implemented a new quality rating and improvement system in 2018. We've used it over time during the pandemic to understand how the impacts of pandemic regulations were affecting the costs our child development facilities were experiencing. And we use it to inform a range of policy choices and decisions over time. One of the unique circumstances in the district is that we do have a universal pre-K program for our 3- and 4-year-olds that's delivered through a mixed delivery system that includes our school district, District of Columbia Public Schools, a significant number of public charter schools, as well as our child development facilities. Because a lot of the children in that program, though, are in our public schools, that creates a difference in the market landscape for our child development facilities that makes it all the more important for us to use cost modeling to understand what the actual costs of serving children of different ages are, because it is more difficult in that context for facilities to do some of the rate smoothing across different ages that we know is part of how many facilities make the still broken business model work a little bit better for them. So that's an important part of the context in the district as well.
So it's fair to say that both of you sort of saw this as an additive, not a substitute. Is that fair to say?
Absolutely. I think, as we have looked at things like setting childcare rates, we recognize that we need to understand what parents are paying in the market now, and we need to understand what it's costing programs to provide the services they currently provide right now, current course and speed. And we need to understand what it would cost if we were doing it right, if we were able to pay the adequate wages, if we were able to have the more adequate staffing patterns, all of that. Market rate survey helps us understand what people are paying now in the market. The cost analysis helps us understand the system that we're trying to put together. Both of those pieces of information are critical for us to develop effective policy.
The district actually has used the alternative methodology as a substitute for a market rate since 2015. So we did not conduct a market rate survey because we were doing an approved alternative methodology for several years. We actually are in the process right now of doing a childcare provider survey that includes both information on tuition that can meet the requirements of a market rate and a lot of questions to help us inform our understanding of costs that we can use the next time we update our cost estimation model. And the reason that we're doing that right now is because we have legislation in the district to increase compensation of our early childhood educators in child development facilities. This year and last year, we distributed payments directly to our early educators, but starting in our fiscal year 2024, we will be sending money to child development facilities in exchange for an agreement to increase pay for their staff. In order to make sure that we do that in a way that provides the resources necessary for facilities to meet those compensation goals, we need both cost modeling to understand what it will cost them and better information about tuition revenues, because the program does include facilities that don't participate in subsidy, as well as facilities that serve a mix of subsidy participating and non-participating children. I do think in all these conversations, it's really important to remember that just because a facility participates in subsidy doesn't mean that's where all its revenues come from. And many of our subsidy participating facilities are still serving mostly private pay families. So if we don't know how the two revenue sources fit together, that has implications for how well we can support our facilities.
It's interesting because I'm pretty sure we must have some people on this call or on this webinar right now who are thinking about doing this that haven't done it. What advice would both of you, starting with you again, Teresa, what advice would you have for state leaders or others who are thinking about doing this? What sort of are your lessons learned, if you will?
My first lesson learned is to put the child in the middle of your model. So really understand what it is that kids need, and then what their families need for them to be able to receive high quality early care and education. That's how we built our models. We built them with equity in mind. And so we're not saying that every program, every child needs the same thing. And so we've actually built a suite of models that we can put together and use flexibly to understand varied needs. So some families need full day, full year care. Other ones need only part day programming. You know, in the childcare world, that may not be the way you think, but in Illinois, all of our cost modeling has always been about the early care and education system as a whole and all the different services that kids and families might need. So it really is a suite of models. Even if you're just looking at childcare, family childcare is a completely and utterly different beast than center-based childcare. The way that you need to create and build that model is really quite different. So it's understanding what it is that kids and families need, building program models around that, really trying to understand who wants what and who needs what, so that you can start estimating out what that is going to be across your whole system. But just that thinking about the kid and the family first, and from that building out, what does the model actually look like?
Thank you. How about you, Sarah?
I would emphasize stakeholder engagement. The federal requirements for alternative methodology talk about stakeholder engagement, but I think it's important to think about, if we really want these to achieve the goals we have for them, we need much more robust stakeholder engagement. Partly, there's information we need to receive from child development facilities about how are you actually structuring your business, not just what licensing requirements require, not just what we assume, but what is really the way this works in practice for you and your staffing models, different costs that you have. What your tuition is actually important for this. So there's information we need to get, but it's also sharing information about the models with people who are participating in these programs and rely on them for their business's sustainability deserve to understand how we're making decisions about what we pay them. But it's also an opportunity to really bring your community along and help them understand some of the issues that Sam was talking about earlier. We, our child development facility operators they amaze me every day with the work that they're doing, their commitment to children, the way they make things work against all odds. But we have an opportunity through cost modeling work, when we really engage the community, to help build the capacity of our partners who are operating the facilities to really also look critically at costs and revenues and use the same kinds of tools to think about how they can support the sustainability of their businesses over time and where the decisions that they're making affect things or make them easier or harder. And that's a real opportunity to build capacity across the community that can only be realized if you have really robust stakeholder engagement.
And when you say stakeholder engagement, can I ask you, do you mean just the providers, or are you including, when you do that, do you include parents?
We have not done a lot of engagement with parents around the cost estimation model, but we have actively engaged sort of our advocacy community and some groups in our advocacy community that engage parents. I do think cost modeling can be a really useful tool for engaging with parents, though I know when I talk to parents, the two questions that always come up are, one, how do I find childcare? And then second, why is it so expensive? And that also comes up when we talk to policymakers too, but that cost modeling gives you the ability to actually walk through with people why it is so expensive and explain, it's not that, this is just completely unreasonable and people are trying to hurt working families. This is actually the reality of what it takes to serve children who are incredibly vulnerable when they're young in a way that protects their health and safety and is able to continue operating.
I want to pause here for just a second and tell the audience that we are going to be taking your questions. So if you have questions, and I know we've already got a couple in the chat, but go ahead and put them in the chat because we'd be more than happy to answer or have a discussion around them. I want to get a little bit more into this policy. How, to both of you, what policy changes did you actually make because of using this methodology? And Teresa, why don't we go back to you?
Yeah, I mean, certainly in the response to COVID, we used our cost modeling right away to help us understand what was the loss that we are going to see in revenue to programs because we were requiring them to serve fewer children in a classroom. And we were able to use that immediately to go to our legislature and say we needed hundreds of millions of dollars just to keep our programs from collapsing. And we're fortunate to get those resources in May of 2020 to be able to put towards helping to save our childcare programs. And I attribute a good amount of that to being able to have the data at the ready by using the cost modeling and understand what impact it was really going to have. More recently, as we've implemented all the COVID relief strategies and the stabilization grants, we've been able to really zero in on what is the delta, what is the difference between what programs are paying right now to their staff and what that means services cost versus what it would cost if we were paying more adequate wages, and start to develop policy solutions for addressing straight on that difference in compensation. In Illinois, we're not thinking about that as being put into the childcare payment rates because, again, as people have said here, not every kid is getting subsidy. That's not going to be a viable way to move wages in the market. We're looking at how do we cost out and structure interventions to give money to programs to be able to raise wages, and cost modeling is absolutely vital for that.
Sarah, how about you? Policy decisions that you've made using the data?
So before I get to that, I just want to underscore the last point that Teresa made about the importance of new funding models as a solution to some of these challenges. I mentioned the Early Childhood Educator Pay Equity Fund, which is the district's effort to increase compensation for the early childhood workforce. And we went through a very intensive task force process with a wide range of stakeholders, but the ultimate outcome of that work was a recognition that that couldn't be done through subsidy rates alone, and that we needed to create a new funding source for this program, which is why we're implementing it the way we are. So I just wanted to echo that. As Teresa said, I do think, it was interesting, Sam, in the paper, you make a distinction between demand side and supply side and talk about subsidy as being a demand side strategy. I am not sure that all of our facilities or all our advocates or all our policymakers actually see that distinction and see subsidies as a demand side, but often think of them as a supply side strategy. And, when you only have one hammer, everything looks like a nail, but subsidy is not the solution to every problem in this space. And so I just appreciated that framing. We have used it, just as Teresa said, the cost model for a wide range of COVID relief strategies. It helped inform the funding amounts for our COVID relief grants. We used it to justify increasing our subsidy rates during the period of the public health emergency when attendance was restricted at child development facilities. But we also, you can use the cost model to inform policy decisions, but you can also use it to help you understand how different policy decisions might affect the costs for childcare. So, for example, we updated our licensing regulations in 2016, and we're able to use cost modeling to understand how changes in those licensing regulations would affect operating costs for all providers. And then that translated into informing the rates that we set as part of our next CCDF state plan.
And thank you for that, Sarah, because you just answered one of the audience. Nathan out in our audience asked this exact question: doesn't the fixed cost involve meeting state regulations? And what does that do to the provider's costs? And I think you're saying that your cost modeling addressed that correctly.
Yes. Yeah. I mean, the base we use in our cost modeling is the licensing regulations and what they require, as well as any other district or federal laws. I think Teresa mentioned minimum wage. We have similar policies. I think the place where it actually gets tricky is when you move beyond those things that are required by licensing or laws to actually try to figure out, in addition to that, the market shapes how much it costs. So we know that the labor market is changing. Amazon is opening their 2.0 HQ in the DC area. That affects labor costs for everyone in our entire metro area, from CVS to childcare to other businesses. And so trying to model what that means for our child development facilities is really challenging.
One of the things that I've been pointing out for many years now, and that gets back to my own experience with the military model, is that in the military model, we put the money into the program side of the equation to keep the fees down on the other side of the scale. And I think people lose, they just sometimes have a hard time grasping the distinction between it going into the subsidy side versus going into the program side, and the stability that going into programs brings to that. So we're starting to get quite a few questions here. And Sam, why don't we bring you back into this conversation here so we can take some of these questions. But here's another one that says, from Kathy, do you know the cost of, or do you know of a state that has used a facilities cost model? Mm-hmm. And if so, what was included? Does anybody know the answer to that in terms of the facilities piece? Other than, Sam, you pointed out the rent or that is, has to be, whether it's a rent or a mortgage.
Let me say, I think that there are a few different types of facilities cost model, and I'm sure Sarah and Teresa have something to contribute around the ways that they've used this. I think there are states that have used a facilities cost model to look at the gap of facilities in order to provide the care, and then seen the delta of what kind of sort of one-time or short-term facilities investments would need to be made to build capacity, versus I know that there are some states that have done some facilities to look at the state or the quality of their current facilities, and seen, we did this in Massachusetts, for example, and looked at some of the current investments that would be needed to help current providers just maintain facility investments, as you pointed out, which includes rent, lease, but also upkeep for many of the childcare providers that we looked at. So I think there's a functional operating facilities assessment, as well as a sort of facilities need assessment that often both use cost modeling structures.
Teresa, did you use that in Illinois in terms of some of the work around the childcare deserts I know that that's on a lot of people's minds. How do you cost out what it's going to take to get childcare in places where there's complete lack?
Yeah, we leaned on our school system to help us understand this. That schools get built a lot more frequently on the public dollar than childcare centers do. So we were able to take some information from our school construction side to help inform. We did do a pretty large state capital investment in facilities for infants and toddlers and preschoolers. And we're able to use those sort of estimates to say, how many classrooms do we think that might be able to build for us in the state?
Okay. Now we have another question from Maria, and it says, how does cost modeling incorporate funding for serving children with special needs? Sarah.
I think that's a great question, and I'm not sure anybody has really answered it perfectly yet. We in the district do have a special needs rate in our subsidy program that pays an enhanced rate to programs that accept childcare subsidies, and we do some work in our cost modeling to inform that rate. I think there are two challenges with that, though. One is that children with disabilities, by definition, have really widely varying needs, and some of those needs are less expensive to serve than others. There are also different revenue sources for children with some kinds of needs that can be tapped and that can't be tapped for other things. So trying to set a rate through cost modeling, or to model something that is so individualized when many facilities are quite small, is very difficult. And we see this same issue in public school finance too, with why some states have created high cost pools for special needs and things like that. The other issue with trying to fund special needs care through a subsidy rate is that, as we've talked about on this, subsidies are tied to individual identifiable children. And so all the things Sam was saying about needing to build your capacity to expand are also true for building a facility's capacity to serve children with disabilities that require significant support. It doesn't make sense for a facility unless they're part of an organization that has a broader mission for serving individuals with disabilities. It doesn't make sense for a facility to invest in building that capacity if they then are going to have to wait to enroll a population of children with disabilities in those slots, because the facility cannot afford to hold slots open. And so you get situations where we just inherently have undersupply because we're not funding this in the right way.
Teresa, did you look at that at all in the Illinois work?
We have looked at it, and one of the challenges that we came across right away is a lack of defined models of how we're actually planning to serve young kids and families with disabilities in community-based settings. So that we're spending this past year and the coming year doing some really deep work with community-based partners and our State Board of Education to build out some of these models so that we can actually do the cost modeling of it.
And one thing I will say on that is another complexity in this space is, once a child is 3, they have a FAPE right under IDEA, and that has certain standards for the services a child is entitled to. Before a child is 3, they qualify for services from Part C, early intervention. But in terms of the standards for what their entire childcare experience is, there is not a comparable standard for defining what is necessary to serve a child. And so there is just a degree of complexity. It's left to the parent and the provider to negotiate what can be provided and what the child needs. And so that makes it harder to cost things out. But it also, in a lot of cases, probably means that children aren't getting what they actually need.
Teresa. This isn't, I'll be curious as to your response to this. Let me just read the question for you and then see what you think. I said, given the $20 hourly wage needed on average to even rent a 1-bedroom apartment in the US, shouldn't we be advocating for more generous wage increases for caregivers in discussions about childcare affordability? Okay. Teresa.
This is, I think, one of the most challenging issues that we've got is how to think about where we need to set wages. And I'm going to be a little hard-nosed on this and say we need to set wages to be competitive so that we actually bring folks into our industry and keep them there. And so that is actually less about what it costs to live in a place that is what the market of wages are for the full range of the economy in a given community. So we're really zeroing in on comparisons to healthcare and to social work and to for interest-based positions that may be similar, so that we would attract the same kind of people who might want to work in our field. And on the entry into the field, low barrier to entry kind of positions, what are folks making, or where might they be lured away to if they are just someone with a high school degree or a few credit hours in early childhood, where might they be lured to? So we do have to pay attention to what Walgreens or Target are paying. But it's really about the competitiveness of the wages that we're able to pay. And we're woefully behind on all of that. But that's, for me, the more powerful operating principle.
Mm-hmm. And I think, in answer to that, and Sarah, I don't know if you want to jump in on that, but to me, that's exactly why we need to do the cost modeling, because we need to know the impact of what it is we're proposing in order to, to justify, the funding that we need. And I think to a certain extent, that's held us back now for, the last several years. And we don't have the data we need to support those increases until we're in a crisis. And then we're just pedaling to keep up. Sarah, what would you say about that?
It's not my role to tell anybody in an advocacy position what to advocate for. I would agree with everything Teresa said. And just also note that if the market is doing these things and policy doesn't do anything, the market's going to do what it's going to do, and we're not going to like the results.
Mm-hmm. That's good. How about you, Sam?
Yeah, I think that this is the penultimate question right now, is how can you drive wages and be competitive, as Teresa and Sarah have said, with other industries that exist around childcare providers and are recruiting their workforce out of the field. How can you actually do that without facing, as Sarah referred to earlier, the question from parents is, why is it so unaffordable? And I don't know, I think, Linda, to your point, I don't know that we can do that without cost modeling and without seeing if we do, whether it's a required or incentivized or whatever type of wage intervention we want to make, we have to be able to do that with understanding what it's doing to the families who need this care to go to work as well. And I think that's the role of cost modeling, and the opportunity we have is to find the release to that tension between those two real difficult problems.
I think one of the other things that, that enters into this conversation is this issue, of right now, I think there are a number of states, probably many on the line right now, who are in states where they think if we just increase the ratios in, in some of these rooms, that we're going to fix this problem. And I think if there's one thing that cost modeling can show, it's probably that's not the answer. Have either of you done any work in trying to either reduce or increase your adult child ratios in any cost modeling that you've done, and what did it show?
Sure, like I had mentioned, we created a suite of models to look at different program approaches. So for an example, we looked at our current licensing standards for infants and toddlers and 2-year-olds, which allow for up to 16 2-year-olds in a classroom with 2 teachers, as opposed to the early Head Start standards, which require you to have those same 2 teachers, but only for 8 children in a classroom. And not surprisingly, that does make a pretty big difference in the cost per child that the program is going to cost. So we do look at that and try to understand. Another place where it really is important what you're thinking about the number of kids in the classroom is how full are providers on average, because we know that there's a lot of programs out there that run not very full, and that makes a really big difference about how much resources they have based on the tuition that they're able to collect from the families enrolled.
Can I say that I do think that while this is a really, to Teresa's point, that the number of children obviously per teacher does matter in your cost modeling. We have to think about the labor market overall as well. And when we look at wages and you start to put 16 toddlers in a classroom, it's very difficult to recruit staff that is willing to stay in the field and do that work and stay enrolled at that level, and all of the dynamics that have to happen. And so I think that one of the things that, again, reiterating the fact that cost modeling isn't a silver bullet. Once you might be able to find the right price point, but you also have to think about it in the context of the people and the families that are there on a daily basis, and understand how that all fits together.
I think one of the hardest points for the non-early childhood community to understand about childcare is what happens, especially, and Sarah, you are in the city where we do have UPK. What happens to the cost of doing infant toddler only? And I know that sometimes people think it's a lot simpler equation than it really is. But can you talk a little bit about what has happened in the district with because you've now got UPK, and what's happened to some of these, and how did you use cost modeling when you looked at the infant toddler issue?
Sure. So as you referenced, and I mentioned earlier, the district has universal pre-K starting at age 3. One of the ways that we have tried to support our child development facilities in that context is by having programs that allow our child development facilities to offer publicly funded pre-K, which is funded at the same rate as our public schools receive for pre-K students. However, that is only a subset of our child development facilities that do that. And so for our other child development facilities in the district, in many cases, that has meant needing to shift their capacity in terms of recognizing that they will not be serving as many 3- and 4-year-old children, and will be serving, more infants and toddlers relative to that. And so that has significant implications, as you mentioned, because infants and toddlers are more expensive to serve than preschool age children. And typically what childcare providers do is they sort of make up a sort of loss leader for the infants by charging more as the children get older. And when you can't do that, that has implications in the district. One of the things that happened is that the district passed legislation in 2018 called the Birth to 3 Act that was intended in part to respond to this. And one of the things that legislation does is actually requires us in statute to do cost modeling and use it to set our subsidy rates. And it sets the intention that our subsidy rates would cover the full cost of infant and toddler care. We seek to move in that direction through our cost modeling. And one of the things that we've done with our cost modeling over time is to focus more of our resources on increasing the infant and toddler rates relative to some of the other rates in the cost model. Our school age care rates were actually higher than the cost of care, but our infant and toddler rates were lower. And so we have increase the value of those infant and toddler rates relative to our preschool rates and relative to our out of school time care rates over time.
I don't know, Teresa, if you wanted to add anything to that or move on.
Oh, that makes sense.
Okay. Okay, the next question, how does cost modeling ensure equity of access for the subsidized children that approximate access for unsubsidized children unless the provider supports are generally available to all providers? That's a complicated question, and I think, Teresa, you and I have talked about that in the past. And that, how do we do that? I mean, in other words, the subsidy rates could go higher ultimately than the parents of non-subsidized children can afford.
Right. I mean, it certainly works if you're going to raise the percentage of the population that has access to subsidy rates to, the 80-90% that was envisioned in Build Back Better, then by all means set the reimbursement rate where it needs to be to cover the full cost of care, and you've largely solved the problem. It doesn't work if you are trying to get folks to be able to access mixed income settings. And so, where I live in DuPage County on the outskirts of Chicago, the vast majority of folks who are getting subsidy are attending a program in which only a minority of the kids are subsidized kids. So if we're not attending to the cost differential between what parents in this community can pay and what we're saying is the true cost of care, and subsidizing that somehow, it's not enough to just look at the subsidy rate that's being paid.
I'll add to that, Teresa, that in Massachusetts, one of the struggles we had is incentivizing people to accept subsidies. What in Massachusetts we called a subsidy contract. And one of the challenges of that is one of the ways that cost modeling can really help overcome that is what price point, what other strategies, what other interventions could you use to help offset the cost of maybe accepting, to Teresa's point, a few, not a whole program full of subsidized children, but maybe a few more subsidized children, which could have profound impact on the number of programs willing to serve low-income families. And so I think those are some of the ways that this could really play out in an equity lens. Is if you look at more supply side interventions, there's opportunities to consider the infrastructure and ensuring that infrastructure is available and open to families that need tuition subsidies, and aren't only limited to those programs that can afford to either only serve subsidized children or afford to take a financial hit in order to do so.
This is another really interesting question, and I think this one is for the states out there with fairly conservative legislatures. I think this is really something that is a struggle. It says my state does not have sufficient funding to raise the current rates to the 75th percentile, let alone fund supply side interventions. Given those constraints, why should we use a cost model at all? Good question.
Well, number one, it's an advocacy tool. I will say that to help folks to understand what's really happening in the childcare market. I think that even in the most conservative communities, folks value teachers, and they understand pretty viscerally that it's not fair for teachers of young children to be paid poverty level wages, and being able to sort of demonstrate why that is may help with the advocacy of trying to get resources devoted to this area.
I think also in a context where your resources are constrained, the cost modeling can actually help you make thoughtful decisions about how to prioritize the resources you have. So if you do cost modeling and it shows you that, for example, the difference between your current rates and the costs for infants and toddlers is much larger than the difference between your current rates and the costs for preschoolers or for out of school time care, then it helps you support an argument for, if on the margin we can make investments, we should make those investments in infants and toddlers, as opposed to, and that can actually make potential investments seem cheaper, right? If you say, we're going to do this investment in infant and toddler rates as opposed to across the board, that may fit better in the fiscal box that you are in some cases. So we can give you a few alternatives to just 75th percentile across the board that may help you have a bigger suite of options to take to legislators in a context where that may not be a possibility, but maybe there are some other things incrementally that could be.
I always think, I don't know how you make an argument without data, though. And I think at the end of the day, that's what this gives people. And maybe you don't win the argument every time, but at least you have the data that you need to make the argument and try to make the case. I don't think, ignoring the problem and it doesn't go away with that. How much did it cost you guys in terms of your funding? How long and how? Just give a ballpark to people.
To do the cost model?
Yeah.
So I actually did the cost model when at an advocacy organization, and so I don't have an answer to that question because we just did it.
Okay. Sarah?
So they first did it before I was here, and I can't speak to that. And one thing that you can do is actually work with some of the consultants that exist out there to build tools. I mean, ultimately the cost models are all basically the same as any financial model that you use in a consulting or business context. And so if you build the tool and then you have some people on your team who understand the tool, you should be able going forward to actually use the tool, for like the big picture purposes, like, updating for the CCDF state plan, but also we used it all the time for just little things that we wanted to understand, particularly during the pandemic, because we had it in-house and we had built capacity to do it. So that can affect the costs involved. And sometimes the costs that people look at for this are like all the costs, including like a big glossy report and, all the stakeholder engagement and things. Those are things that probably are useful to do sometimes, but don't need to be done all the time. And people can think about how they want to chunk those out.
And I am remembering now with the initial PDG grants and stuff, we did some workshops for folks about thinking about this, about what you might need to do. And I think that on the light end, somewhere around $100,000, on the really heavy stakeholder engagement end, probably around $300,000 is a reasonable ballpark for states to be thinking they might need to invest in this.
And when you think about the amount of other funds that these are driving the distribution of, that is not a big amount of funding to be spending to drive those funds in a more rational way.
Well, and once you get the tool and the system built, it's easier then after that just to make those modifications that you need to make. Sam, how about you in Massachusetts?
In Massachusetts and Chicago, we invested in cost modeling, and to Teresa's point, it ranged depending on the purpose we were using it for, anywhere from, I think we did some very, very preliminary baseline tools for tens of thousands of dollars as opposed to 100,000, and then did have some modeling that went up to hundreds of thousands of dollars. I'd say right around maybe the $300,000 or $400,000 range. I will say though, this was an opportunity in both the jurisdictions that I was in of offering pooling resources across what the state might be able to afford, what an advocacy organization or a legislature might require, because to Sarah's point, it's a tool that can play multiple roles. And so it's an opportunity if everyone all the stakeholders can coalesce around a specific kind of model or approach to cost modeling that will meet the multiple needs. It's an opportunity to really defray costs or to pool resources.
I think to me, it's an interesting conversation because I don't know too many businesses that don't use a cost model. I mean, how do you price a product if you have not looked at what it costs to do the work? And I think for early childhood, this is a new concept, but it really isn't, that new of a concept for anybody in business. And we are being forced, I think, like it or not, for these programs to understand some of these tools. So, okay, well, I think we're getting close to the end here. Any final thoughts just that we'd like to, what would you say to your audience that you have learned from all this, and final thoughts as we wrap it up? So Sarah, let's start with you this time.
I'm just excited that more people are thinking about this. And I think that the report provides some really useful frameworks for a variety of levels of how you can think about cost modeling, both from the purposes that are stated in CCDF around market rate setting, but also more broadly for informing programs and policies. And I hope that folks who are listening to this with a variety of hats on can keep in mind that cost modeling isn't just about subsidy rate setting, that there are lots of other things that you can do with it.
Teresa?
I would say that once you have a high quality cost modeling engine or a good Excel workbook built, you'll be amazed at the different things that you can do with it, and then the kinds of questions you can ask of it. And it will really start to drive all of your thinking around your early childhood policy.
And Sam, at last to you.
Yeah, I agree with everything that was said here. I think really, I think that the final thought is that this is a huge opportunity for a sector that is scrambling to try to keep up with the parent need. And we have an opportunity to use these new tools. And I hope we do. I hope that there are people willing to really think not just how do you replace what exists, but how do you actually think differently and innovatively. And I think I have been incredibly overwhelmed by how innovative state leaders have been in trying to come up with solutions. And these can only make those better, more efficient, more effective in really saving, I think, the future of childcare.
You know, and I do think as we close this out, as we move ahead, and we all know you mentioned some of this, Sam, in the intro, everything is in a state of flux in this country. The workforce, how many hours of care they need a day, a week, a month is changing radically. Where they work is changing. And so in order to, I think, stabilize this market, we do have to understand the supply side of this issue, because the supply side is not stable, and it probably won't be for quite some time until we get through all of the changes that are happening with the world of work, which is why we have childcare. So it's complicated, it's complex. Again, I think to close this out, we think this is not a silver bullet, as I think some people have been sort of putting out there. Oh, well, we just do a cost model and we'll fix everything. It isn't a silver bullet. There aren't any, but this will help us make the case, I think, at the local level, at the city level, state level, and ultimately here in Washington, as we try to make the case for the funding that we need for these programs. So I think with that, I really do want to thank Teresa Hawley for joining us, Sarah Mead, very much so, and then to Sam and Caroline for all the work they've done on the presentation and on the paper. Hopefully this will inform things out there in the country. And if you have other questions, be sure to let us know. For those that ask the question, yes, the slides will be on our website. The paper is already there. And any further questions you have, just feel to contact us, or I think there are a lot of people out there willing to help people to understand the balance that doing both a market rate survey and a cost study could help you with. So with that, I think we have one more slide we wanted to put up there that just shows you the events that are coming next from BPC. So if you are interested and have time, we will be releasing our latest state governance report. Several years ago, we looked at state governance. And we have updated that, and we'll be doing a webinar in early January on that. And then you see the other ones there on the slide. So with that, I want to thank everybody for joining us again, and we appreciate your time and interest in the subject. And if we can be of any further help, just give us a call. So with that, we'll sign off for today. Thanks again, everyone.